what is Bionic in a simple way that's easy to correlate that information across to the client? Because the blessing and the curse with Bionic, everyone says the same thing, is that it's so versatile. It treats so many things, so many skins, that sometimes it's hard to condense it down for the client that you have in front of you in terms of a consultation. So, first and foremost, what is Bionic? When a client says, what is the system? So the Bionic is a pulse triggered laser. It's a low level laser or a cold laser. And both of those things just mean the energy that's being emitted from the handpieces are working at the temperature of the human body. Instead, we're creating a stimulation effect or photobiomodulation within the cell. Now, the Bionic process or method is a trilogy concept, and this is why it's unrivaled and can't be compared with other low level light based devices that are on the market. That trilogy is the lasers themselves, so your cold lasers, your hyaluronic acid gels, which obviously you've got a selection you choose dependent on skin type and concern, and then they are upregulated and improved in terms of their absorbency through the use of the pulse reader, so the pulse trigger. So, what does the pulse reader do, or what's the benefit to the client for doing that? What it does is it creates a bespoke delivery of energy for every single person that you see, every single day that you see them. So, the purpose of the pulse reader is to capture the point when the cell is it has accumulated the most toxin. The reason that we read the client's heart rate is this is usually at the moment of every fourth heartbeat. So you'll notice when you do a treatment that we get this flicker or what we call wobble of light on the skin that is emitted around about every fourth heartbeat. That is going to create this kind of contraction effect on those cells. It's forcing the cell to excrete its cytoplasm and the toxins that it's been holding on to. And then as the cell re-expands, when the lasers aren't flickering, we create an empty cavity. So the initial round of the Bionic laser process is dry laser without any gels on completely depleted skin. And that is to empty. We then go ahead and apply your antioxidant gels. And then as we create this contract and expand process within the cells, they are sucking that hyaluronic acid and those antioxidants through the cell lipid bilayer. And as we know, our cells have a life cycle of around about 28 days on average. And because those products are taken through the cell wall and they're stored inside the cell, they will last for at least 28 days in the skin. So what your clients need to understand is in terms of hydration and 3D cell protection, and alongside that, the volume and everything that we create, it's completely unparalleled in terms of anything that we can apply topically, which we have to apply for the most part twice a day. We are actually storing that in the skin for around about a month. Before we go into questions, I guess the follow-up question I would always go on to then is, why do we normally have a Bionic regularly initially? What's the purpose of that once a week course? And that's to do with that cell life cycle. If we are losing that cell that we have fully hydrated and fully protected every 28 days, if we only see the client once a month, we are constantly going up and down. We're giving an instant effect, but we're not creating longevity in the skin. We want to see somebody at least more than once within a 28-day cycle so we can start increasing storage of water around the cells and making those antioxidants more effective within the skin. So if your client wants to see an improvement, whether that's acne, rosacea, aging, pigmentation, whatever it is, they need to come in more than once a month initially to build upon the results.
So what are the wavelengths?
Okay, so in your handpieces, you have got red and near-infrared laser diode. The red is 658 nanometers, and your near-infrared is 808 nanometers.
Just to clarify, it is laser, not an LED.
It is a laser. The difference comes in actually the physics of LED versus laser. The reason a lot of people, especially clients, talk about it as an LED is there's no pain, there's no tug. We're treating the similar sort of condition because we're stimulating the mitochondria. However, where it differs is its absorption and its depth within the skin. So an LED light is a light bulb which has a certain color. And as we turn that light bulb on, the energy will spread out. What's happening is hitting the skin, and some of that will bounce off, reflect, some of it will be absorbed. And as being absorbed, it's called an attenuation of energy. We lose some of that absorption and the effectiveness, especially as we go down to the deeper wavelengths, like your near infrared. Whereas your laser energy is a collimated beam and it doesn't lose that attenuation. It's emitted, it's absorbed straight into the skin, and it reaches all the way down to bone. So there's no loss of efficacy. In terms of stats and things, what your clients might like to know, about 10 minutes of low-level laser is almost equal to 30 minutes of LED. So it's not that LED is not as good, it's just it takes longer to do the same job. The bionic laser is being driven by your client's own pole. That's impossible with LED.
Okay. Brilliant. What class laser is this?
It's a class 3.
Is there any contraindications to sun exposure or having a suntan in comparison
None.
to your class 4?
No. And the reason is half because of the class. The class really dictates the amount of risk. And in the bionic, there is no risk to skin. There's no risk to anyone else in the room. The only real risk is within 3 inches of the eye with the eye open. Obviously, you and your client has safety eye protection as a additional mechanism. That's the only risk. Whereas your class 4, depending on activity, there's risk to burning the skin, injuring the skin, etc.
Right.
So I was then saying you said, does that pose any additional contraindications? So no, because there's no heat, that's the main reason why it doesn't matter whether you have suntan, sunburn, you're going on holiday. We're not looking at the melanin in the skin as an absorption mechanism. Okay. So it doesn't matter what Fitzpatrick they are or how tan someone is, how much melanin they're storing, because the laser energy is not looking for that, only looking to seek down the mitochondria.
Brilliant. And what conditions does it treat?
Everything. It will support all skins. The reason I say that is that 2 fundamental things that it resolves is the loss or lack of energy and the lack of water in the skin, which happen through age and through inflammations. What does the bionic excel at? I guess would be the best question, because you've got multiple choice in your clinic, would be highly inflamed or compromised barriers, acne, rosacea, topical steroid withdrawal, perioral dermatitis, and also your aging skins that are thin, fragile, and inert, because they will not tolerate very well anything that's a little spicier on the skin, because the skin hasn't got the resources it needs to heal and repair.
Brilliant. And how many treatments would you recommend?
Always at least 6. Course of 6, a week apart, ideally. However, if you're dealing with what I would say diseased skin that's not happy, non-functioning skin, I would be saying that is your starting point, and you may well need 8, 10, or 12, because you may need to do some different protocols within the course. You can't necessarily jump straight into the rejuvenation phase. You first of all got to control whatever it is that's going there. You might need to do laser on its own or use the ectogel first before you can go on to rejuvenation.
And what would you recommend in terms of maintenance thereafter once they've completed a course?
So in an ideal world, a client would have a bionic every month, because we know we have storage for 28 days. However, when you're in a clinic where you're lucky to have access to other modalities, it's not always reasonable to expect your client to have a bionic every month alongside needling, RF, peels, etc. So, as a worst case scenario, I would like a client to have one at least every 3 months, but they should be coming to the clinic every month for some sort of stimulation treatment within the time.
Okay. Okay. And is it important to use a bionic seal?
Yeah, it is. So, Bionic Seal, recap on the ingredients. You've got 2% ceramides, you've got black oat and oatmeal extract. The ceramides are the important part there because they are literally the locking bond in our hydrolipid film. They are keeping that barrier sealed, hence the name, therefore locking the moisture in the skin and providing environmental protection at the same time alongside an SPF. Dependent on protocol, if you're going off the rejuvenation, cellular rejuvenation protocol, standard would be 5 minutes for your Fitzpatrick's 1 to 3, 7 minutes Fitzpatrick 4 to 5, and 10 minutes Fitzpatrick. Okay. And the reason why that's different, because it's almost counterintuitive against every other light-based device we're used to expose your darker Fitzpatricks to more energy than your fairer Fitzpatricks. The reason is that your melanosomes, or within the tissue, are creating blocking like bricks within the skin that's making it more of a challenge for the light photon to travel through because we're not absorbing the melanin. We are just trying to navigate our way past down to the mitochondria. So that's the reason for more exposure to acid level. If you're doing the quick power or you're doing dry laser, you don't need to change the time because 10 minutes will be enough for everybody.
Perfect. And how long should you massage the cleanser and the enzymatic peel for?
Okay, so cleanser, I would say you want to massage for a couple of minutes each application. I would go over with the brushes first, and then I would go on with your gloved hands and actually work that product in. And your enzyme, 2 to 5 minutes, dependent on sensitivity levels on the skin. But the key is the skin has to squeak. It has to physically be squeaky. Otherwise, the Wakame algae in the gels won't penetrate because there's oiled lipids water blocking that product from getting in.
Brilliant. And what are the benefits of, firstly, the high energy cellular mask
Power
and
mask?
the night care mask?
Yeah. Okay. So comparison against the two. So your Supreme mask and night care or your blue mask, the purpose of that is lipid saturation. Basically, it's to restore the hydrolipid film that we have very tactfully removed at the beginning of your treatment. So for your clients that are more lipid dry or more mature naturally, that's going to be their best option. In there, you've got your ceramides, your aloe, your jojoba, a little bit of lactic acid, and it's all about re-expanding those hyaluron molecules that have been placed in the skin. The client can feel quite a lot of activity. It's not the ingredients that are in there, it's the re-expansion, and the additional water leaves those little nerve endings a bit more exposed. So that's the tingling that you get. The power mask, your clear or green tub mask, is about environmental defense and resilience within the skin. So that's a stem cell base. You've got white tobacco, tomato, and raspberry stem cells with some hyaluron. So you're still getting the hydration, but it's going to be better for those that are more compromised, maybe pigmentation, people that are stressed, they've got red skin. That's going to be better placed. Shall I give you two options? Option
Yes.
1 for rejuvenation, option 2 for inflammation, because your positioning is going to be different. For rejuvenation, I would always start in both scenarios going through first. What is Byonik? It's a trilogy method. It's unrivaled in the market, and that is because we are customizing, or the machine is customizing your treatment for you every single time I see you. Now, for your skin, where you're looking at maybe some age prevention, age management, what we know has happened as part of the aging process is your body starts to produce much less of the good things and much more of the bad things. And we want to restore some equilibrium. And the Bionic is going to tap in and start resolving some of those issues that you have started losing over age. So the first one is we are going to be increasing energy in your cells. Now, I'm sure when you were younger, you had a lot more energy to do things. And now, if you're like me, you might need a bit of an afternoon nap throughout the day to get yourself. Your skin's exactly the same. You're born with an abundance of energy because you're building all of these structural proteins and fibers in the skin. And as we get older and we lose the energy, the skin's thinking, oh, all I need to do is just be a barrier. Forget producing collagen, elastin, and anything that makes you look amazing. So what we want to do is refill that energy tank up so that your cells, we trick them basically to thinking they're younger again. They've got this abundance of energy that they were born with. So they start producing collagen and elastin. And for you, that means we get nice, tight, plump, smoother skin. At the same time, the other thing that we lose as we get older is water. You probably notice you feel more dehydrated now than when you were younger. You feel like you need a richer moisturizer on your skin. So we're going to be infusing super rich and hydrating serums that the laser is going to push into your skin cells at all of those layers, and it's going to hold on to those for as long as possible. So as a result, you'll feel that your skin looks smoother, tighter. We can see that from the first treatment. We'll take photos to show you, but also your skin's going to feel much more hydrated as well. Okay. That's option one. Option two, we've got an inflamed skin, angry skin, compromised barrier. In this instance, we have got an inflammatory overload in the skin. And with inflammation, two things are often visible: redness, and we get transepidermal water loss. When our skin's inflamed, everything doesn't sit right and we start losing the water molecules from the skin. So for your acne, what we're going to be using is a non-thermal form of laser. And that just means you're not going to feel any heat or pain on the skin. And this is really important because your skin is already inflamed, already trying to recover from this injury level within the skin. So I don't want to exacerbate that and make that any worse. Instead, I'm using a non-thermal form of energy, which is in the healing and repair spectrum. And it's going to trick your skin into thinking something is injured and make it start to heal itself. And at the same time, working at the level of the blood supply to restrict that visible inflammation, but also carry nutrients to so that it can heal itself more effectively and reduce the pain that you're feeling in the skin. We're also going to apply some lightweight hydration into the skin because although you might be feeling oily with your acne, you would probably be lacking in hydration. So we're going to be getting the hydration back in, and that's going to mean that you're not producing as much oil. Now, one of the benefits with the Bionic in terms of acne-prone skin is that we don't have that process of intentionally making the skin worse before it gets better, which is necessary in a lot of other modalities. We are, in fact, activating the lymphatic system and we are detoxifying the cells. If you remember when we spoke about what the pulse reader is doing, we're pushing those toxins out, and then those toxins are being transported through the lymphatics. So you should see an improvement straight away rather than the skin purging straight away. Okay. You will need to come in quite regularly initially because your body is arguing with me constantly and producing this inflammation. It's got a bacterial overload on the skin. So these regular treatments initially are going to control all of those components: the inflammation, the bacteria, the excess oil, and the pain and discomfort that you're feeling in the skin as well.
Thank you. Now, when will I see results and how long do those results last?
Okay. So for most people, they see a result straight away. Now that result can vary from person to person. when I talk about seeing a result straight away, it's in regards to how hydrated the skin feels. People always comment of my makeup goes on nicer. I've not woken up with my pillow lines in for a few days and the skin feels more comfortable. We can also see something called an immediate biolift effect. And that just means all of your fibers that are all tangled up and in a mess underneath the skin, the laser comes and realigns that dermal matrix. Okay. Visibly, what that means for you and me is that when we look at your immediate before and afters, those little fine lines, especially around the eyes, around the mouth, look smoother straight away. Now, for most people, that immediate result lasts visibly for about a week. The results internally at a cellular level will continue for at least 28 days.
Who can you not use the enzymatic peel on?
Okay, so the only people you cannot use it on is somebody with an open skin, open, broken skin. Some people don't like to use it on acne and rosacea. However, for both of those skins, they tend to have more keratinized cells on the surface that it's actually beneficial to buff them away. So that would be on a case by case scenario. If the skin is open and broken, no. But otherwise, yes, but maybe just for less time rather than 2 to 5 minutes, 1 to 2 minutes is fine.
When you mentioned about having the squeaking effect with the enzymatic peel, in order for the wakame ingredient to penetrate,
Uh-huh.
if you're not able to use that on broken skin,
Uh-huh.
still benefit them? Or would you just
If you've got open, broken skin, you would always be using either just laser or the ectogel. Now, the ectogel doesn't require that squeaky skin to start because it doesn't contain the wakame algae. It's actually designed to wrap the surface of the skin a little bit like an invisible plaster. So if you're using the ecto, it's not essential to get a squeaky clean. Of course, the skin must be clean, but it's not as essential to remove that hydrolipid film. If you're using blue, orange, white, or your Plus Max Superior, the skin has to be squeaky. Okay, so if you're in that decision making process of, oh, I can't use the enzyme because of XYZ, it's pointing you in the direction of ecto automatic.
perfect? Okay, brilliant. I think that's pretty much all the questions, unless you've got anything you'd like to
Quick fire round.
ask, like, what are the best combinations
Yeah.
in for specific skin conditions?
Obviously, your ecto repair gel, we've just covered that. It's a plaster for the skin. It's there to basically provide a superhero cape around your cells that are stressed, aggravated, and non healing. Wraps them, the cell repairs, it draws water to the area to realign your protective film, basically. Okay. Then you have your Plus Max and Superior, which are all intended for rejuvenation or volume in the skin. Your blue gel is a HA only base, i.e., it doesn't contain those potent antioxidants. And the reason for that is we have an option that doesn't overstimulate the skin. For skins that are not heavily compromised, i.e., ecto, but they're still breakout prone, sensitivity prone. And then we have your orange, where we introduce, or your max, where we introduce the antioxidants. And then your white or your superior, which have the exact same ingredients in as your max orange, but the density level is 12% more, so it's more viscous. Now, in terms of the skin, your blue will travel the deepest, then your orange, and then your white. Now, I tend to use the analogy, or think of your outcome as you're trying to make a cake. So when you first meet someone is when you have the idea of you want to make a cake. And you can't make your cake without having a sponge. If you don't have a sponge, it's not a cake. And your blue gel, your plush gel, is that sponge. It's your base layer, it's the foundation. Everybody needs that initially, regardless of their skin type, their age, their health. That could be enough for some people, especially if they are a little bit more sensitive or prone to breakout. Or if you've got somebody that's concerned with the aging process, or maybe they've got some concerns that they want to brighten, think of that orange or max gel as your cake filling. You're going to put some jam or cream and it's going to make everything look nicer, taste nicer, and just increase the vibrancy. Okay. So that's your step up for those types of skin. So blue and orange, or your sponge and your jam and cream, again, that can be enough. That's a lovely, delicious cake. However, if, like me, you're not a baker and you take your cake out of the oven and it's all lumpy and bumpy and you got bits falling off, you've got to do something to smooth the edges to fill the gap. And that's where your white or superior comes in. That is like your fondant icing that wraps the shell of your cake and smooths the texture. Okay. So you're never going to go in on treatment 1 with white gel, because what's the point in putting icing on a cake that doesn't exist?
What class laser is this?
It's a class 3.
Is there any contraindication to sun exposure or having a suntan in
None.
comparison to your class 4?
No. And the reason is half because of the class. The class really dictates the amount of risk. And in the Byonik, there is no risk to skin. There's no risk to anyone else in the room. The only real risk is within 3 inches of the eye with the eye open. Obviously, you and your client has safety eye protection as a additional mechanism. That's the only risk. Whereas your class 4, depending on activity, there's risk to burning the skin, injuring the skin, etc.
Right.
So I was then saying you said, does that pose any additional contraindications? So no, because there's no heat, that's the main reason why it doesn't matter whether you have suntan, sunburn, you're going on holiday. We're not looking at the melanin in the skin as an absorption mechanism. Okay. So it doesn't matter what Fitzpatrick they are or how tan someone is, how much melanin they're storing, because the laser energy is not looking for that, only looking to seek down the mitochondria.
Brilliant.
So in terms of combination, blue and blue together, if you've got a skin that is healthy but prone to breakouts or prone to sensitivity concerns, or a client that's around 20 years old, that their skin's producing what it needs at that point. Blue and orange is a nice combination for those that are going into their 30s or they want to brighten their complexion. Blue and white is a good point for your more mature skins or anybody with textural irregularities that you're wanting to smooth. Okay. You can, of course, then go to orange and white as you go through the course to get more viscosity and more plumping in the skin, but only after you've done blue and white first.
Would you ever use white and white? And if so, who's potent?
Okay. I've tried it a couple of times, but I don't love it purely because you're laying it all down in the same area very superficially. And that means you're probably going to lose it more quickly. The only time where it would be suitable per se is if somebody has consistently and very regularly come in and maybe they have got an event that evening or the next day where they just want to smooth the skin. But otherwise, I always would prefer to have different depths of hydration infiltrated into the skin.